We begin here first tonight with legal advocates in North Carolina pushing for the state to expand Medicaid sooner rather than later. There is a coverage gap in North Carolina that leaves thousands without health coverage. It's because their income is too high to qualify for Medicaid, but it's too low for premium subsidies through the federal health insurance marketplace. As WCNC Charlotte's Kendall Morris explains, there are two bills on the table in North Carolina's General Assembly that could provide some relief.
The push to expand Medicaid in North Carolina growing louder.
There are ways to get this done, and the legislature needs to stay in town until they get this done.
Earlier this month, state senators passed this bill with bipartisan support. It would provide Medicaid coverage to adults who make too much money to be on Medicaid currently, but don't make enough to afford health insurance through the Affordable Care Act.
These people are literally too poor to get health coverage. And most of them are working. About 65% of them, the studies show, are working. And yet they can't earn enough to get Obamacare, and they're just left in this coverage gap.
However, the bill faces an uphill battle in the state House. House Republicans proposing their own plan last week, directing further study of the issue and instructing the State Department of Health and Human Services to develop a Medicaid modernization and savings plan to be presented for a committee vote in mid-December.
This is a way to move forward with a plan that I think will actually help at the end of the day without causing the state any financial hit. Will at the end of the day help those who need help the most.
Attorneys with the Charlotte Center for Legal Advocacy critical of the proposal by House Republicans.
This issue has been studied to death, and the other problem with the House bill is if we don't act immediately, we're going to leave $1.7 billion federal dollars on the table that would flow into North Carolina.
Legal advocates hoping for action soon to see North Carolina join 38 other states that have expanded Medicaid.
As the House and Senate bills continue to be discussed, WCNC Charlotte will bring you the latest on that debate. In Uptown, Kendall Morris, WCNC Charlotte.